This is The Future Of, where experts share their vision of the future and how their work is helping shape it for the better.
I'm David Karsten. New research has found that giving all Australian workers 12 days of leave annually to care for their reproductive needs, such as menstrual pain, menopause, IVF and vasectomies, would save the economy more than $21 billion per year, not to mention vastly improve mental health and workforce retention. Conducted by the Bankwest Curtin Economics Centre, the research was commissioned by the Health Services Union in a bid to have reproductive leave included in the National Employment Standards. But what actually is reproductive leave, and who would benefit? With me today to discuss this topic is Dr. Silvia Salazar and Dr. Abebe Hailemariam. Silvia and Abebe are research fellows at the Bankwest Curtin Economics Centre and conducted the research into reproductive leave, with Silvia leading the project. If you'd like to find out more about this research, you can visit the links provided in the show notes. Well, look, first of all, Dr. Silvia and Dr. Abebe, we must start with reproductive leave as a concept. Can you tell us who does it benefit and why is reproductive leave important?
Yeah, thank you, David. Yeah, reproductive health leave really is a workplace entitlement that allows workers to take several pay days allocated to reproductive health conditions to treat them or manage them. As the name indicates, actually benefit a lot of people with reproductive health conditions, which is more what we would think, because reproductive health conditions cover everything related to menstrual pain, menopause, IVF, things like terminations and miscarriage, but also for men, things like vasectomies and prostate cancer screenings and things like that. So it really will benefit a lot of people. And the idea of reproductive health leave is really to provide equal access to leave in the workplace for people with reproductive health conditions. So as you know, of course, there is different in genders. So more women suffer from reproductive health conditions than men, but also between women, there are women that suffer more from these conditions than others. And we can see that there is a lot of people with reproductive health conditions that take leave. Around 60% of them actually take leave, paid or unpaid, to treat that condition. We actually made a survey about this, and we find that around 44% of the people that take unpaid leave to treat these conditions. And what we try to do, or what reproductive health leave tries to do, is really to equalize the playing field between people with reproductive health conditions and those who do not have one. So it's really about providing equal access to leave for everybody.
This is something that's perhaps more than just conceptual and something more than just an area of study for you. This is actively being called for by certain organisations. Can you tell us who is actually actively calling for this?
Yes, David. So this research actually has been commissioned to us. So we are the Bankwest Curtin Economic Centre by 3 different unions. So the Health Service Union, the Health and Community Service Union, as well as the Queensland Council of Unions, as well as Superannuation Fund, which is called Aware Super. So these are the people that are actually active, involved in this call for reproductive health leave. But it's a call that has grown and has been amplified elsewhere. And now even the Greens have endorsed the proposal, and they're also pushing for reproductive health leave in the workplace at the legislative, at the national level, really.
It's early days yet in Australia and for reproductive health leave as a policy. Can you tell us about how absenteeism and presenteeism costs the economy?
Thanks, David. Yeah, so we estimate the total cost of lost productivity in terms of absenteeism and presenteeism, where absenteeism means where people are taking time off from work, whereas presenteeism means that even if people are attending work, their productivity is reduced because of the reproductive health conditions. So taking these factors into consideration, our study estimates that the annual cost of lost productivity is about $21 billion annually.
$21 billion?
Yeah, that's correct. The majority of the cost, over 80%, emanates from lost productivity due to presenteeism, whereas the remaining 20% is due to absenteeism. In terms of the reproductive health components, the major costs are from menstrual conditions, menstrual pain and menopause, and endometriosis and miscarriage constitutes the biggest part of the cost of lost productivity.
With reproductive health leave as a proposal, how many days annually does this proposal sort of include, and what cost will there be attached to that, as opposed to the $21 billion we're losing annually in lost productivity?
So depending on the conditions and based on data, the average day needed for reproductive health is estimated up to 12 days.
A year?
Yes, 12 days a year, yes.
And how much would that cost the economy?
That's a very good question. Thanks, David. So that depends on several factors. We take several factors into consideration. For example, the big component is workforce structure, like it depends on how many people are employed, and the gender composition, as well as the age structure of the workers, and whether they are working full-time or part-time, and also the earning structure. And we also consider another important aspect about reproductive health conditions, for example, the prevalence rate for each reproductive health condition, and how many people with the condition can take days off, and also the proportion of people affected by the condition and the number of days that people take off, as well as the utilization rate. Based on this information, we consider different scenarios, especially based on the utilization rate for the leave utilization rates, like low, medium, and high scenario. Based on this, our medium scenario estimate showed that the annual cost of providing up to 12 days of reproductive health leave is $3.6 billion a year.
3.6 billion a year.
I think there is a lot of figures here, so sometimes it's really hard to understand them all.
Yeah.
So I think I just wanted to probably just kind of try to clarify. So there is something that is really called like the cost of reproductive health, right? Which is basically if you have pain when you have your period, where you have issues and symptoms with your menopause, that costs the economy because you have lost productivity at the workplace. So when you go with a flu at the workplace and you can't work as much as you did, or you don't go because you're sick, and that cost amounts to the 21 billion. And some of these costs can be offset, but not all of them, right? And then when we talked about providing reproductive health leave, is really we're just talking about these costs related to people not going into work. So it's really the absenteeism a bit, right? Where we're looking at people that will take leave and not go to work. And that's what is the cost of reproductive health leave, which is 3.8 billion. But providing that will make that people will be more productive, and it will make that companies will have lower turnover costs because people are more likely to stay where they are.
It does.
It would also mean
it encourages loyalty, doesn't it?
Exactly. People will have better well-being and all these sort of things that have been shown in our survey. So all this, they will have benefits coming out of this reproductive health leave. And those benefits are what we estimated to be about 1.7 billion. So that's why the overall cost of the measure actually per employed person is only around $140 per employed worker per year, which is really, really low when you're really thinking about that. We always talk $1 billion and it just seems so high, but if you really bring that per worker per year, it's just 140 people.
Dr. Silvia, some listeners might be listening to this podcast at the moment and wondering, well, look, if reproductive health leave is actually probably going to benefit mostly women, then why not just give all women more personal or sick leave? What is the need there for having a designated leave for reproductive health?
I think when you talked about having this reproductive health leave, it's actually legitimizes the issue, and it's not a woman's issue. It's a lot of the things that we're always thinking about is a woman's issue, and then women are the problem, and then more discrimination and so forth. And men will actually use a lot of this leave because, as I say, there is leave provisions for vasectomies, but also prostate cancer screening and so forth. So men will also benefit of that. But we want everybody to know that this is a reproductive health. It's a couple's issues because women are the ones that are childbearing, but it doesn't mean that men are not getting anything out of the children that the women have. It's really as a couple thing. And for instance, IVF, like IVF, a lot of when you do IVF, men also have to play their part in the IVF journey. And if men will able to go with their partners to all these appointments that they have to go, we know that women going through IVF have a huge mental toll, a lot of suicidal thoughts and so forth, and having their partners with them will definitely alleviate these sort of issues. So having that designated as a reproductive health for everybody is not just for women. Will also reduce the stigma at work and also avoid discrimination.
Well, this is relatively new for Australia as an idea and as a concept, but it's been around for a while elsewhere. The Soviet Union and Japan introduced menstrual leave in the 1920s, and Spain also made headlines in 2023 for approving 60 days of paid leave for period pain. Now, how successful have these countries been in introducing menstrual leave, and did their approaches help to inform your research?
Thanks again, David. So as you are right, it's not a brand new concept in terms of overall reproductive health concept, but it's important to be mindful that no country so far has implemented a comprehensive reproductive health leave.
Right.
Yeah.
Okay.
So that is the main point here in terms of overall reproductive health. But like several countries implemented a version of it, and mostly in terms of menstrual period leave. In terms of the success stories, the evidence shows mixed results.
Mixed results, is that?
Yes,
Right.
Yeah, so of course there are advantages or benefits that workers benefit from those reproductive health leave. But then why I say mixed is that because the biggest challenge for those countries implementing this, especially the menstrual leave, is that there's low utilization of the leave provisions. And one of the main reasons is the stigma or discrimination associated with the reproductive health leave. And another reason is the requirements, for example, for Spain, for example, implemented in 2023, and employees are required to provide medical certificate if they have to access the leave. And that becomes a big barrier for employees to access leave because of the requirement.
So just to recap there, one barrier is having to get a medical certificate to access this leave. But the other thing is, you're saying it's the optics for people wanting to utilise this leave. They're concerned about how that is received by their management or the rest of the workforce in their workplace.
That's a very good question. Actually, that is where also that informs our research. So we implemented a survey, and so about 70% of the respondents, they say they are not comfortable to tell their managers.
Right.
And the main reason is because like most of those introduced leaves are about the menstrual leave. Therefore, people are not comfortable to go to their managers and tell about it. So that is where the stigma, that's because of stigma and discrimination. Yeah.
So could that be a cultural thing in other contexts where this has been tried, and would it be different in Australia, do you think, Dr. Silvia?
Yeah, and I think that's an important point that Abebe was making, is just having that name as reproductive health leave and not having to provide the exact reasons to access that leave. It's important because then basically if you have to go to your boss and say, I'm taking menstrual leave, you don't want your boss to know that you're actually having your period at this moment. So it creates a lot of stigma. So having it branded as a reproductive health leave is also important because of those reasons, because it would allow you to exactly disclose which condition you are kind of having. So then it would allow that the uptake of the leave is important, because that's the main concern, as Abebe was saying. It's not so much that it doesn't exist, but you want people to use it. Having it accessible to you without having to provide an explanations or trying to tear down as much barriers as possible, it's important for the leave to be really utilized as you want it to be.
So you're also suggesting that there shouldn't be a need for a medical certificate as well in an Australian context.
Our report is not really about the legal aspect of it, so it's more about the economic aspect. But as Abebe was pointing out, like in Spain from day one, you need a medical certificate, And imagine when you have a cold, right? You have a cold. You're not going to go to your doctor because you have a cold, right? So if you had to provide a medical certificate at the beginning of your sick leave because you have a cold, then a lot of people will not take that leave because you have to pay to go to the doctor, and you have to find an appointment, which is not easy nowadays. So the whole thing just becomes more burdensome. So if at least you have like in sick leave where you have 3 days in which you can take them without a medical certificate, that will already be quite significant, right? And if after that you need a medical certificate, then, why not? But at least have some flexibility at the beginning. Not being able to provide that medical certificate will go a long way.
A lot of positives attached to this, but are there potential negatives as well? If you were to establish reproductive leave in Australia, I mean, a cynic could say that perhaps it could open employers up to gender discrimination, invasion of privacy, those sort of issues. I mean, would employers become reluctant to hire women on that basis as well?
That's a really good question, David, and I think it's something that you could always argue for this to be true or not. I think there is actually some sociologists that are concerned about whether that will perpetuate stereotypes, because women are always seen as weaker, less reliable, more expensive than men, and that can lead to discrimination, really. And our survey, when we actually ran a survey about this, we found that there is a real concern from employees. About 70% of the employees actually think that the employers will use reproductive health leave to discriminate against women. Because, as you were saying, women are the ones who are more likely to benefit from it. But also things like they might, if you say maybe you're going or you're close to menopause, maybe some of the employers will not promote you to that really good position because you might take more leave or so forth. So there is some concern there. And we can see that among the people who didn't tell their managers of their condition, which is about 70% of them, which is a lot. So I guess there is some people that half of those people who didn't tell their managers, about half of them didn't do it because they were scared they will have negative consequences in their workplace. So it is a real concern. However, whether that actually translates into discrimination, that's something that we still need to see. We know that parental leave, which is a significant amount, is 6 months per year, has not led to the discrimination that we thought it would. It's still there, but I think we can always think it might lead to some discrimination, but really 12 days is not that much as 6 months and so forth. So I think there is the case of saying, yeah, maybe there is probably that wouldn't make that much of a difference. And it's not because you're a woman that you will use it. Actually, a lot of the companies that have put that in place in Australia have a very low uptake of leave as well. And that's just because, you think that people will take that more than they actually do. So you can argue that, and it's a fair point, but whether that will actually translate into discrimination, this is something that we will see probably.
Well, it's interesting you say that it's not necessarily taken up, even though it's available to some Australians. That obviously leads us on to the fact that it has been implemented in one state already, hasn't it? Can you tell us a little bit about what's happening in Queensland? How is reproductive health leave working in that state, and what is the uptake and a bit more on the response to that so far?
Queensland actually legislated 10 days of reproductive health leave last year, and it was implemented from September, October last year. So it's a bit early for any evaluation to be made out of what has happened.
Firstly, how was that received?
Yeah, so I think it was really a push from a lot of organizations in Queensland. Among them, one of our partners in this research, the Australian Council of Unions. They really wanted to try to bring this, and I think it was really well received overall. I think, of course, some companies were always a bit concerned about, especially small companies, that what that will bring to them. But I think overall it was very well received, and there hasn't been much pushback when that came out. So that 10 days, it's for those conditions that I just mentioned, but they will also have additional conditions like mammographies or prostate cancer screening or things like that. And so far there is not much we can say about the actual whether people are really taking it or not, because it's really early days. But I think it shows that it can be done, and it can be. And this is just, as you were saying, Queensland, but there are many other companies that have put this in place, as well as through EBAs that have been pushed. So, for instance, the Health Service Union has tried, actually through the ABH, they push the the Victorian public servants to have, I think it's only 5 days of reproductive health leave, but they managed to push it through EBA. So I think this is showing that there is appetite for this. So yeah, hopefully it's something that could be generalized to the whole country.
Now, your research centre, the Bankwest Curtin Centre for Economics, is based here in WA. Have you seen any interest by our state government, such as the Minister for Women, in the report that might inform future policy changes?
That's a good question. Not so far. I think the elections were a big concern when the report was delivered, and then there was the WA elections and the federal elections. But hopefully, there is something that they will become interested on. With hoping to legislate that at the national level. But of course, if that's not possible, of course, the state level, it's a way to go, like Queensland. And yeah, that'll be great. And I think especially in WA, because there is so many FIFO workers, they're always saying we need more women in mining. But then, when you are in a mine and so forth and you don't have access to things like that, that can prevent some women from going into that mining sector. But maybe putting that in place might help them to just cross the bridge and just take that additional step to get into the mining.
In terms of the numbers that you gleaned from your research, I mean, we covered them earlier on in the conversation, but did those numbers surprise you in terms of, I guess, the sheer depth and breadth of lost productivity in particular?
I think so. It was really interesting, like working this with the team, because I'm a woman myself, but I think you don't realize what other women go through, like in a way, like I've been really lucky and I'm a very healthy person, but just realizing how much those conditions affect people's life it was kind of what it really shocked us the most. I think we talked about the prevalence rates. Yeah. We thought there would be a lot of research about menstrual pain and menopause and so forth. So we thought okay, so we just take the research that is out there and we just kind of find out the cost. But there was almost no research.
Oh my gosh.
And that's why we were led to do this survey, because we realized, well, there is no data that we can work with. We have to run a survey. And then once we get the data back from our surveys, we were always discussing these prevalence rates, like how many people suffer from these conditions, that we say, this can be true. Can this be true? Because it was so surprising how much of those, how significant, how many people suffer from these things, and we don't realize them because, this is because of the stigma attached. Nobody talks about these things, right? Even though, all women go through menopause, all women have their periods, but we never really talk about it. So I think for us, once we realized that the prevalence rates were so high, that also brings those numbers into productivity and of lost productivity to become really high as well. So yes, I think we were really surprised about, first, the lack of research, and second, how many people are affected by these conditions.
Well, look, you did mention earlier too that one of the stakeholders that was supporting you in, I guess, commissioning this research is the Health Services Union. What's next for this research that you've completed? Will this be part of mandating reproductive health leave more broadly?
That will be the idea. So as I was telling you, for most of these unions, they are trying to push this through EBAs as much as they can. But the next step is definitely having a national legislation about reproductive health leave. The Greens actually endorsed our proposal, and they introduced in March of this year a legislation to provide reproductive health leave. So I think the now Greens leader, Larissa Waters, she introduced that legislation. So what we're hoping to achieve with this is actually provide all Australians access to reproductive health leave, especially for those people who suffer these conditions and has really having it tough at the workplace without having access to this leave.
So for both of you, is your work in this space done? You've done the research, you've supplied the numbers, and you've made some recommendations. Is that it, or is your work going to continue in this space, perhaps as an extension to this research?
In terms of the commissioned work by the Health Service Union, so we delivered the report, but definitely there will be probably a continuation of the research. For example, once the policy is implemented, another important step is evaluation of how effective the policy is. So there could be a potential for continuing the research on this line. And
that's something you definitely want to be involved in, Dr. Abebe?
Absolutely. Yeah, I love it.
Yeah, Dr. Silvia?
Yeah, definitely. I mean, we actually both do research in gender. We are not health researchers in particular, but we do a lot of research in gender, especially gender in the workplace. So that's some of our expertises. So this is something that, of course, we have a lot of appetite for, and we definitely want to continue. Like, to be honest, I just discovering all these figures just made me think about and realizing how much there is a lack of research for it. Just to continue my own academic research on this, and just really interesting topic for sure.
Yeah, just to add from our experience from our previous workers, for example, we were also involved into the estimation of the cost and benefits of providing 10 days of family and domestic violence leave.
Okay.
Yeah,
okay.
that's also, we did that one also. Then commissioned by the Australian Council of Trade Unions, ACTU, and so that was successfully delivered. As you see, like the policy was already implemented, and then in terms of continuation of work, and then what we did also, like we extend that one into scholarly research, and that report also is published in a journal, in a prestigious journal. So that's how, when we have a project, it has a continuation.
And the research led to the legislation of family and domestic violence leave, which was very significant for the center and for the union as well, of course.
What an impressive record for the two of you. I mean, you are like a couple of very unsung heroes for I guess the workforce across Australia. And look, it's been an absolute pleasure having two really articulate researchers come in to talk to us about a topic that a lot of us would like to know more about. So thank you very much for spending some time with us today.
Thanks for having us, David.
Thank you very much for having us.
You've been listening to The Future Of, a podcast powered by Curtin University. As always, if you've enjoyed this episode, please share it. And don't forget to subscribe to The Future Of on your favourite podcast app. Bye for now.